Tonight, before you go to bed, I need you to stop doing something that millions of seniors do every single night without a second thought. Something so ordinary, so deeply woven into your bedtime routine, that the idea of it being dangerous probably seems almost laughable. But I promise you, by the end of this video, you will not be laughing. You will be rethinking everything about how you spend the last 30 minutes before you close your eyes. My name is Dr. Daniel Hayes, and for over 3 decades I practice as a cardiologist and cardiovascular researcher. I have stood in operating rooms at 2 in the morning, repairing the damage that preventable heart attacks leave behind. And I have held the hands of families trying to understand why someone who seemed perfectly fine went to bed one night and never woke up. Today I am sharing what I know, what the research clearly shows, because you deserve to have this information before another night passes. Here is the number that stopped me cold when I first read it. A study published in the European Heart Journal, tracking over 84,000 adults across a 9-year period, found that specific nighttime behavioral patterns were independently associated with a 47% increase in major cardiovascular events, including heart attack and sudden cardiac death, even after controlling for diet, exercise, smoking, and known heart disease. 47%. Not from something dramatic, from habits. Quiet, invisible nightly habits that accumulate damage the way water slowly erodes stone, invisibly, steadily, and then catastrophically. And the habit sitting at number 1 on today's list, the 30-second bedtime mistake I mentioned in the title, is one that I would estimate 70% of the seniors watching this video right now commit every single night. You are going to be stunned. Stay with me until the end, because this one genuinely changes lives. Before we go any further, I want to connect with you personally. Drop your age in the comments right now, whether you are 61, 72, 84, or anywhere in between, and tell me, what does your bedtime routine currently look like? Do you watch television? Take medication? Have a snack? I read every comment on this channel, and your answer helps me create the content that matters most to you and people just like you. We are counting down 6 nighttime habits that dramatically raise your heart attack risk if you are over 60, from number 6 down to the most dangerous one of all. Let us begin. Number 6 seems so innocent that most cardiologists would not even think to mention it in a routine appointment, and that oversight may be costing lives. The habit is eating within 2 hours of bedtime, particularly eating anything high in sodium, refined carbohydrates, or saturated fat after 8 o'clock at night. Researchers at the University of Pennsylvania's Perelman School of Medicine conducted a controlled study examining how late-night eating affected cardiovascular biomarkers in adults over 60, and the findings were striking. Participants who consumed even moderate caloric meals within 2 hours of sleep showed elevated levels of a protein called troponin, a marker your doctor measures when they suspect a heart attack is occurring the following morning. Not at heart attack levels, but measurably elevated above baseline, suggesting that the heart was under low-grade stress during the night. Over months and years of repeated late-night eating, researchers estimated this chronic low-level cardiac strain contributed to a 23% increase in atherosclerotic progression. That is, the buildup of plaque inside the arteries, the biological process that eventually produces a heart attack. Here is why this hits aging bodies so much harder. Think of your cardiovascular system at night like a city's highway infrastructure during off-peak hours. The roads are supposed to be quiet. Repair crews come out to do maintenance, and the system recovers from the day's traffic. But when you eat a late meal, you essentially call every delivery truck back onto the highway in the middle of the night. Your heart rate stays elevated. Your blood pressure, which is supposed to dip by 10 to 20% during sleep in a healthy person, a phenomenon doctors call nocturnal dipping, fails to do so. Researchers have a name for people whose blood pressure does not fall appropriately at night. They call them non-dippers. And being a non-dipper, according to a 2019 analysis in the journal Hypertension, is associated with a 31% higher risk of cardiovascular events compared to people whose blood pressure follows its natural nighttime decline. After the age of 65, your body's ability to regulate blood pressure during sleep diminishes naturally. The autonomic nervous system, the part of your brain that manages blood pressure, heart rate, and vascular tone without your conscious involvement, becomes less precise with age. Late-night eating amplifies this imprecision dramatically. The practical solution is to establish a firm kitchen closing time. Identify a cutoff, ideally 2 to 3 hours before your typical bedtime, and commit to it. If you are genuinely hungry in the evening, opt for a small handful of walnuts or a few slices of turkey breast, which contain tryptophan and healthy fats, but create minimal digestive burden. Pair this habit change with your largest meal at midday rather than evening, and you align your eating pattern with your body's natural circadian metabolic rhythm, which research from the Salk Institute has shown significantly reduces overnight cardiovascular strain in older adults. The scientific references for everything I'm sharing today are linked in the description below. Number 5 is one that most people over 60 do not even recognize as a habit, because it happens passively, and that is sleeping in a room that is too warm. I know that sounds almost trivially simple compared to what you were expecting, but hear me out, because the cardiovascular physiology behind this is genuinely serious. Your core body temperature is supposed to drop by approximately 1 to 2 degrees Fahrenheit as you transition into deep sleep. This cooling is not incidental. It is a biological signal that triggers a cascade of restorative processes throughout the cardiovascular system, including the repair of endothelial cells, the reduction of heart rate, and the suppression of stress hormones like cortisol and adrenaline. Think of it like a car engine that needs to cool down after a long drive before you can service it properly. If the engine stays hot, the service cannot happen efficiently. When your bedroom is too warm above approximately 68 degrees Fahrenheit, your body struggles to achieve this cooling, and the cardiovascular repair window that should occur during deep sleep is compressed or lost entirely. A study from the National Institute of Environmental Health Sciences found that sleeping in warmer bedroom temperatures was associated with increased nighttime heart rate, elevated inflammatory markers in the morning blood, and reduced time spent in slow-wave sleep, the deepest, most restorative stage, by up to 26% in adults over 65. That last point connects to something critically important. Slow-wave sleep is when your cardiovascular system does the majority of its overnight maintenance. Researchers at the University of California, San Diego found that adults over 70 who consistently experienced reduced slow-wave sleep had significantly higher levels of a compound called interleukin-6, an inflammatory signaling molecule, and showed accelerated coronary artery calcification compared to those who achieved adequate deep sleep. Coronary artery calcification is the literal hardening and narrowing of the arteries that feed your heart muscle. It is measurable, progressive, and directly predictive of heart attack risk. I had a patient, Walter, 76 years old, from Memphis, Tennessee. He came to me with persistent morning fatigue, elevated fasting blood pressure, and a resting heart rate that was consistently higher than I wanted to see for a man his age. His overnight heart rate monitoring showed almost no dip between midnight and 4 in the morning. When I asked about his sleep environment, he told me he kept his bedroom at 74 degrees because his wife preferred it warm. We compromised. They lowered the thermostat to 67, and Walter began using a light blanket. At his 3-month follow-up, his nocturnal blood pressure dip had improved significantly. His morning readings were down an average of 11 points systolic, and his fasting inflammatory markers had dropped measurably. One small environmental change. Transformative results. Set your bedroom between 65 and 68 degrees Fahrenheit. If a partner prefers warmth, use separate blanket layers rather than raising the room temperature. Pair this with blackout curtains, because light exposure also disrupts the temperature regulation process through its interference with melatonin production. and the combined effect on sleep quality is additive. Number 4 is the habit of taking certain common medications and supplements at the wrong time of night. Specifically, taking blood pressure medications in the morning when your doctor has never explicitly discussed the timing with you, and simultaneously taking stimulating supplements in the evening that your cardiovascular system is not equipped to handle during sleep. Let me address the medication timing issue first, because this is one of the most under-discussed findings in cardiovascular medicine in the past decade. A landmark study called the Hygia chronotherapy trial, conducted across 40 medical centers in Spain and published in the European Heart Journal, followed over 19,000 hypertensive patients across a 6-year period. The findings were revolutionary. Patients who took their blood pressure medication at bedtime rather than in the morning experienced a 45% reduction in major cardiovascular events, including heart attack, stroke, and cardiovascular death, compared to those who took the same medication in the morning. The same drug, the same dose, different timing, a 45% difference in outcomes. The reason connects directly to that nocturnal blood pressure dipping I described earlier. Blood pressure medications taken at bedtime reach their peak effectiveness during the early morning hours, between 3 and 7 a.m., which is precisely when the cardiovascular system is most vulnerable. Blood pressure naturally surges in the early morning as cortisol rises and your body prepares to wake. And it is during this surge that the majority of heart attacks and strokes occur. Having your medication at peak effectiveness during this exact window is, as the Hygia researchers put it, like having a security guard on duty precisely when the risk of a break-in is highest. Now, on the other side of this equation, many seniors take evening supplements, fish oil, certain B vitamins, ginseng, even high-dose CoQ10, without realizing that some of these can have stimulating effects on the cardiovascular system if taken close to bedtime. Ginseng, for example, has been shown in research from Seoul National University to increase heart rate variability and sympathetic nervous system activity, the fight-or-flight system, when taken within 3 hours of sleep. For a cardiovascular system that needs to downshift into recovery mode, unexpected stimulation is genuinely problematic. Talk to your doctor specifically about medication timing. Bring a written list of every supplement you take and when you take it. This conversation takes 5 minutes and could be among the most important 5 minutes you spend in a medical setting this year. In the meantime, do not change any prescribed medication schedule without physician guidance. But do ask the question. Before we get to the top 3 most dangerous habits, including the 30-second mistake that I know you have been waiting for, I want to take one moment and ask you to subscribe to this channel if you have not already. Every week we publish content specifically designed for adults over 60, grounded in the most current cardiovascular and longevity research available. If this video has already given you something valuable, imagine what you will learn by being here every week. And please hit the like button right now. It tells the algorithm that this information matters, and it helps us reach the seniors who need it most. Number 3 is one that the medical establishment has been slow to address publicly. And I think the reason is that it involves a deeply personal habit that most people consider harmless. And that is falling asleep with the television on, or more broadly, having any screen active and producing light and sound in your bedroom as you drift off to sleep. I want to be precise about the cardiovascular mechanism here, because this goes far beyond the common advice about screens being bad for sleep. A study published in JAMA Internal Medicine, following over 43,000 women across a 5-year period, found that sleeping with a television or light on in the room was associated with a 17% increased risk of weight gain and metabolic disruption. But more alarming from a cardiac standpoint, a follow-up analysis found measurably elevated overnight cortisol levels in participants who slept with light or sound exposure, compared to those who slept in complete darkness and silence. Cortisol, which most people know as the stress hormone, has a direct and well-documented effect on cardiovascular health when chronically elevated. It raises blood pressure, increases blood glucose levels, promotes inflammation in the arterial walls, and triggers the release of free fatty acids into the bloodstream, all of which accelerate the process of atherosclerosis, the artery-hardening disease that underlies most heart attacks. After the age of 65, your body's cortisol regulation becomes less precise. Think of a healthy young cortisol system like a sophisticated thermostat that responds instantly and accurately to the environment. The aging cortisol system is more like an old furnace. It overshoots, undershoots, and takes longer to correct. Additionally, television audio, particularly news programming, crime dramas, or anything with sudden volume changes, triggers what researchers call the orienting response in your auditory cortex, even during light sleep stages. Each time this happens, your heart rate briefly accelerates, your blood pressure spikes, and your body releases a small pulse of adrenaline. Once or twice, this is entirely harmless. Repeated dozens of times across a night of television-accompanied sleep, across weeks and months and years, this represents a cumulative cardiovascular burden that adds up in ways that are genuinely difficult to overstate. I had a patient named Eleanor, 69 years old, from Savannah, Georgia. She had been falling asleep to the evening news every night for 11 years. She came to me with what she described as always feeling like my heart is working too hard, occasional palpitations, morning headaches, and blood pressure readings at home that were consistently higher in the morning than at any other time of day. A hallmark pattern of non-dipping and elevated overnight cardiovascular stress. We established a firm screen-off rule 45 minutes before bed and introduced a white noise machine at low volume. 8 weeks later, her morning blood pressure readings had dropped an average of 14 points systolic. Her palpitation episodes had decreased dramatically. She told me she had not realized how tightly wound her nervous system was every morning until it stopped being that way. The synergy tip here is to combine screen-free evenings with dimmed amber lighting after sunset. Amber light does not suppress melatonin the way blue spectrum light does. Install amber bulbs in bedside lamps, and you create an environment where your cardiovascular system can genuinely begin its nightly transition to recovery mode, well before you actually close your eyes. Number 2 on our list is one that will genuinely surprise you, and I want you to sit with it rather than dismissing it, because the research behind this is among the most robust in cardiovascular sleep medicine. The dangerous habit is sleeping flat, specifically lying completely horizontal, without any head or upper body elevation, particularly for seniors with any degree of heart disease, high blood pressure, sleep apnea, or acid reflux. Here is the physiology. When you lie completely flat, gravity no longer assists your heart in maintaining venous return, the flow of blood from the extremities back to the heart. In a healthy 35-year-old with a strong cardiovascular system, this is managed effortlessly. But after the age of 65, particularly in anyone with any degree of cardiac compromise or arterial stiffness, lying completely flat increases what is called cardiac preload, the volume of blood returning to the heart in a way that forces the heart to work harder during a time when it is supposed to be resting. Think of it like turning up the pressure in a pipe that is already under strain. Over the course of a night, this sustained extra workload elevates levels of a compound called BNP, brain natriuretic peptide, a marker that cardiologists use to assess cardiac stress. Chronically elevated overnight BNP is associated with accelerated cardiac aging and increased heart failure risk. Researchers at the University of Leeds published a study in the Journal of the American College of Cardiology demonstrating that patients with existing heart conditions who slept with a 30 to 45 degree head and torso elevation showed significant reductions in overnight cardiac workload, lower morning BNP levels, and reported dramatically improved sleep quality compared to those sleeping flat. For patients with both heart disease and sleep apnea, two conditions that coexist in roughly 40% of seniors with cardiovascular disease, elevated sleeping was associated with a 34% reduction in apnea events per hour. Sleep apnea itself deserves a moment of focus here, because it is grotesquely underdiagnosed in the senior population, and its cardiovascular consequences are severe. Sleep apnea, where breathing repeatedly stops and starts during sleep, causes oxygen levels in the blood to drop repeatedly throughout the night, triggering adrenaline surges that spike blood pressure and heart rate with each episode. The American Heart Association has classified obstructive sleep apnea as an independent risk factor for hypertension, coronary artery disease, heart failure, atrial fibrillation, and stroke. If you snore loudly, wake frequently, or feel unrefreshed despite a full night in bed, please discuss a sleep study with your physician. This is not a minor quality of life issue. It is a cardiovascular emergency hiding behind ordinary-sounding symptoms. The practical intervention is straightforward. Use a wedge pillow, a firm, angled foam pillow available at most medical supply stores, to elevate your upper body between 30 and 45 degrees during sleep. This is different from simply propping up your head, which can actually strain the neck and create its own problems. The elevation should begin at your lower back and lift the entire upper body as a unit. Pair this with sleeping on your left side when possible. Research from the Mayo Clinic and confirmed by multiple subsequent studies shows that left side sleeping reduces the heart's workload compared to right side or back sleeping by altering the mechanical pressure on the cardiac chambers. And now, number 1, the 30-second bedtime mistake that I have been building toward. The habit so common, so universally practiced, that the majority of people hearing this will feel a cold recognition when I name it. The most dangerous nighttime habit for your cardiovascular health after the age of 60 is going to bed dehydrated, and specifically, deliberately restricting your fluid intake in the evening to avoid nighttime bathroom trips. I understand completely why people do this. Getting up twice, 3 times, 4 times a night is exhausting, disruptive, and for anyone with joint pain or balance concerns, genuinely risky. So the seemingly logical solution is to stop drinking fluids after dinner. It feels like a practical, sensible compromise. It is, from the cardiovascular standpoint, potentially one of the most dangerous decisions a senior can make on a nightly basis. Here is what happens in your body when you are even mildly dehydrated. And understand that mild dehydration means only a 1 to 2% reduction in your body's total water content, a threshold most seniors cross without feeling thirsty, because the thirst mechanism itself weakens significantly after age 65. When you are mildly dehydrated, your blood volume decreases. Your blood becomes measurably more viscous, thicker, stickier, more prone to clotting. Your heart must now work significantly harder to pump this thicker blood through arteries that in most seniors have already lost some of their natural elasticity. Think of the difference between pumping water through a hose versus pumping honey through that same hose. Your heart does not get a choice, it simply works harder. Researchers at Loma Linda University in California, one of the most respected institutions in the world for cardiovascular and longevity research, published a landmark study in the American Journal of Epidemiology, following over 20,000 adults across 6 years. They found that adults who drank 5 or more glasses of water daily had a 54% lower risk of fatal coronary heart disease compared to those who drank 2 glasses or fewer per day. The risk reduction was most dramatic during the overnight period specifically. The researchers identified that morning heart attacks occurred significantly more frequently in individuals with measurable overnight dehydration markers compared to those who were well hydrated. The overnight period is the cardiovascular danger zone for dehydration because it is the longest stretch of time most people go without fluids. As your blood thickens and your heart rate subtly elevates to compensate, You are also experiencing the early morning cortisol surge I described earlier. This is why the window between approximately 4 and 10 in the morning accounts for such a disproportionate share of all heart attacks and strokes. Dehydration amplifies the natural morning cardiovascular vulnerability into something far more dangerous. After the age of 70, kidney function declines gradually, and the kidneys become less efficient at concentrating urine, meaning more water is lost during the night than in younger adults. Simultaneously, many seniors take diuretic medications for blood pressure or heart failure management, which further increases fluid loss during sleep. The combination of reduced thirst sensation, reduced kidney concentration capacity, diuretic medications, and deliberate evening fluid restriction creates a perfect cardiovascular storm that plays out silently every night in bedrooms across the country. I want to tell you about a patient who brought this research home for me in a very personal way. His name was Frank, 81 years old, from Columbus, Ohio. Frank had been restricting his evening fluids for 4 years on the advice of a well-meaning but incomplete suggestion from a urologist who was trying to address his nocturia, his frequent nighttime urination. Frank was a proud, independent man who drove himself everywhere, still took his morning walks, and had never had a cardiac event. He came to my office for a routine cardiovascular check, and his morning blood viscosity markers and inflammatory proteins were among the most elevated I had seen in a non-hospitalized patient. We identified the evening fluid restriction as a primary contributing factor. We worked with his urologist to address the nocturia through other means, timing his diuretic medication earlier in the day, reducing sodium in his evening meal to decrease the osmotic pull that was causing the excessive overnight urination, and introducing a bedside urinal to eliminate the safety risk of nighttime bathroom trips. Frank began drinking a full 8 ounces of water with a small pinch of mineral salt, approximately